so much. Bill Miller, when he talked about Mercy Otis Warren, I want to tell you that I am named after Alida Otis, who was my grandmother, who's a direct descendant of Mercy Otis Warren. So liberty is in my blood. She wrote a history of the Revolution, and her brother said no taxation was representation up in Boston. So she's an inspiration. I have every book that was written about her is on my library. Well, I would like to be the first woman senator from the state of New Jersey.
Yeah.
And I've read that Obamacare law. I really have read it. It took me a while, but 2,700 pages. There's 20,000 pages of regulations that have been written ever since, and I haven't read them. But experts are trying to figure out how to make a terrible law work. Remember we were told we have to pass this bill in order to find out what's in it? Well, I think we're finding out. I assure you, if I were a senator, I would not be passing bills, but I don't know what they say.
Absolutely.
And I just would take my job way too seriously to do that. Well, here it is, 3.5 years later, and I guess the president just finished reading it. He just decided that we better wait another year to implement it, and the employer mandate can wait. Could it be that he's hoping to get more Democrats in the legislature in 2014 so that that law would be repeal-proof? Well, we need to do everything possible to have that not happen. These people are relentless. They won't give up. No one understands this law. And what's an insurance exchange? Does anybody have any idea? How's it supposed to work? Supposedly, it's a way that we're going to get to choose an insurance company. But the insurance company is going to be told exactly what it has to have in the insurance policy, and then we get to choose the logo, I guess, of our insurance company. But we're going to find out that insurance is unaffordable. And so, then you have to fill out a 60-page form. But they said, no, there's a 20-page short form you might be able to fill out in order to get the subsidy for the insurance. And then who's going to pay that subsidy but people who else can't afford the insurance? So it is just absolutely untenable law. Obamacare is already hurting people. I had a patient that just told me she was all dejected. She's an aide in a school. She works 37 hours. She was called in and said, we're going to cut your hours to 29 and a half because we can't afford to buy you insurance and we don't want to pay that $2,000 fine. But wait, now I think maybe she can go back to 37 hours because Obama just gave it a stay of execution for a year. But hopefully the whole thing will just collapse under its own weight and then we'll have to have something different. Well, American people are finally waking up. They said recently that the majority of Americans don't realize that they're going to have to pay for Obamacare. And when they're told that they have to buy insurance that's way too expensive, they're not going to tolerate that. What's this law going to do? It's going to take money away from Medicare. It's going to cause the IRS to hire 16,000 more agents. No. In the words of the Declaration of Independence, it's going to cause swarms of officers to harass our people and eat out their substance. It's going to create the Independent Payment Advisory Board that will decide whether or not we live or die. It's going to create these accountable care organizations, which are huge conglomerates in which the money goes in at the top and then it comes down. And if the doctors do less for you, they will get a bonus because there's going to be money at the end. That just sounds like such a conflict of interest I can't even imagine. It is going to expand Medicaid. Medicaid takes 1/3 of the average state budget. Now, I'm from New Jersey, and so I've studied New Jersey numbers the most. $13 billion we spend on Medicaid, and our whole budget's $33 billion. What a huge waste of money. And the system is so bad, and the reimbursement to the doctors is so low that most doctors don't take it. So go figure. It's going to decrease access to care because many physicians are going to retire early. And young people are going to be hurt the most. The average young person spends maybe $850, that's what they have figured, on healthcare each year. But under Obamacare, the least expensive plan will be $200 a month. And that's going to be a high deductible so that really they're not going to get any medical care 50, they're still going to have to pay. And these are the same people that have huge college loans, that are paying way too much interest, and they can't find a job. If I were a young person, I don't know how I could be a Democrat and put up with this kind of law. This law is clearly unconstitutional. I don't care what the Supreme Court said. Because where does the Constitution allow the federal government to meddle in our lives in such an intrusive way? Well, what's the best solution? There's 3 parts to medical care, and here's my quick solution. The first is for the routine care, you just ought to pay cash. Just like you go to the Jiffy Lube to get your car service, you pay cash for that. Insurance ought to be reserved for the big things, like what it used to be, hospitalization. People need to be able to buy the insurance they want, with the coverage that they want, with the deductible they want, from the state they want. In other words, freedom. But what about the poor? We can't forget the poor. And ostensibly, that was the whole reason for Obamacare in the first place. What about those who can't pay for anything? They don't have anything to eat. They don't have clothes to wear. They're really struggling. They're living in their cars. What about them? Well, I have found that the American people are very generous. And it's the way we were from the very beginning. You just saw your neighbor in trouble, you helped them, and you did what you could to get them back on their feet. You didn't go to the government and ask for a big program that would help the poor. So 10 years ago, my husband and I started the Zarephath Health Center in central New Jersey, and it's a non-government free clinic. It's non-government. It's very, very important, because what it is neighbors helping neighbors. Volunteer physicians and nurses see 300 and 400 patients per month, and we're only open 12 hours a week. It's extremely efficient, and it's real charity. It's very uplifting. And the neat thing is it doesn't involve the taxpayer. You see, I am not a community organizer.
Thank God for that.
How to organize other caregivers to help those in need. The cost to provide care in our clinic is about $13 per patient visit, and we don't charge people anything. If they want to put a couple dollars in the box, they can. But I write a yearly appeal around Christmas time, and it's a lot of people's favorite charity, because they know 100% is really going to help the poor. Contrast that with the Medicaid program. The cost to provide care is $13 billion, and the whole state budget is $33 billion. Government charity enriches people, but not those who provide the care and not those who get the care. And I don't really know where all that money's going, to tell you the truth. But what it does is it confiscates money from the taxpayer, and then I call it trickle-down charity, where the money is coming from the taxpayer, 90% is going to the administrators, and maybe 10% trickles down to care for the poor. Well, we have a law that we've introduced in New Jersey, and that's how I've gotten to be known by a lot of the Tea Parties and Republican groups in New Jersey, because I've been talking about it. And that is where doctors who would donate 4 hours a week in a non-government free clinic like ours would get medical malpractice protection for their whole practice instead of being paid. It's really a very ingenious idea, and it would really save a whole lot. And what we do is go back to where it was before we had free government programs. But facilitating this type of thing is what good government does. Let the hard-working people keep more of their own money, lower taxes, strengthen families. I'm going to close with a story to explain what happens every week in our clinic. A young woman took a heroin overdose, put her head on the railroad tracks, and hoped the train would come so she could die. She was in such despair. Well, she woke up in the hospital. Somebody saw her. She was rushed to the hospital. And over the next couple of days, they stabilized her. But then, what do you do? Somebody in that hospital said, you know, why don't you just go over to the Zarephath Health Center? They'll take care of you. Well, she came in, friendly people saw her, and they took that information, learned a little bit about her, and then she saw my husband in the clinic. And she had her head down. She was very, very sad. And her mother had committed suicide. Her sister had committed suicide. She had been abused as a child. Life was hopeless. He was able to just touch her and say, you know, there's a God that loves you. And he really does care about you. That's why we're here. We care about you too. So she left, And there was something in her that was sparked with that conversation, because when she was a little girl, she'd gone to a church and a Sunday school. She sought a place to go again. She came back a couple months later. She said, you know, I'm off drugs. Thank you so much for all you did to help. That was just community helping community and not taking a lot of taxpayer money to do it. And that's what we need to reproduce all across the country. So go to ecpercented.com. Help me get elected.